Thank you guys so much for joining us today. We're here to give you a COVID update and also an update on our hospital capacity and some changes that we've made to our hospital surge plan. I'm here with Commissioner of Health, Dr. Lance Frye, Matt Stacy, the Health Department's Surge Plan Advisor, Patty Davis, President of the Oklahoma Hospital Association, and Jim Gebhardt, Community President of Mercy Hospital. I also want to thank Mercy Hospital for hosting us today. I also want to thank all of the healthcare workers who have been working so hard for months, taking such good care of Oklahomans. I know they've been putting in long hours, and on behalf of Oklahomans, we appreciate you so much for the effort of keeping Oklahomans safe during this pandemic. We've always been transparent with our data in the state of Oklahoma, and we'll continue to be. Part of the reason we're here today is because we're seeing an uptick in our hospital counts across the state over the past few weeks. But I want you to know we have the hospital beds, we have the capacity, we have the workers available to take care of COVID and non-COVID patients across the state of Oklahoma. We've been in constant communications with our hospitals, and we've been supporting them whatever they need. We'll be announcing a revised version of our hospital surge plan in just a few minutes. The health department and our hospitals have worked together on this plan just like they did on the others. We're so fortunate in Oklahoma to have a very strong, robust hospital system across the state of Oklahoma that works very well together. They are experts. Our preference is always to partner with them and support them. We do not want to mandate how they run their care or their business. We are so grateful to have the partnerships that we do with our hospitals, the hospital association, and the medical community. We'll hear from Patty and Jim in just a few minutes. They'll talk about how the hospitals are going to be working together and to keep that capacity moving forward as we go forward. Also want Oklahomans to hear this. Just because we have room in our hospitals does not mean this virus is over by any means. We need to continue to take this very seriously. We need everyone to watch their distance, to wash their hands, wear a mask when they're around others. As we learn more about this virus, it's clear we have to keep protecting our most vulnerable Oklahomans. You can spread COVID-19 even without showing any symptoms. I want to remind Oklahomans to be really careful when you gather with your family and your friends, especially your older relatives. As we get closer to Thanksgiving, that's especially important. Take care of your older relatives. Even consider getting tested before your get-togethers with your extended family, even if you aren't showing any symptoms. Also want to remind Oklahomans that we continue to have 80 free test sites set up all across the state of Oklahoma. We've never shut those down, so those are spread across the state of Oklahoma for your convenience. We've made great progress in how long it takes to get those test results back. You can find out where those are located by calling 211. Now I'm going to turn it over to Dr. Frye for an update. Dr. Frye?
Thank you, Governor Stitt, and to our leaders and hospital system that have been working diligently to manage our situation on a daily basis. I want to start by giving a quick situational update on the latest COVID numbers for Oklahoma. As of this morning, there have been 109,548 cumulative cases of COVID-19 in Oklahoma. Of those, there are 1,475 are active or new cases that have been within the last 14 days. Those were new cases, were 1,475 as of today. New cases over the past 14 days were 14,533. There are 870 COVID-19 patients currently hospitalized. 790 of those are COVID positive. 80 are are persons under investigation that they have symptoms or feel like they might be positive but have not tested yet. 1,191 total deaths in the state. 2 were identified in the past 24 hours. As of yesterday, we had 13% ICU bed capacity or availability throughout the state, and a steady supply of PPE is available statewide. As we see the number of cases increase, we want to remind everyone that if you're not feeling well, please stay home. But if you feel like you need to see your doctor or go to the hospital, please call your doctor or go to the emergency room. If you have difficulty breathing or symptoms consistent with bluish lips, low oxygen or face, or inability to wake, or some changes in consciousness or confusion, please go to the emergency room. We understand that there's been a lot of news surrounding hospitalizations, and while the numbers increase, and it is very concerning, we want to reassure Oklahomans, as the governor said, that the hospitals have capacity to take care of both COVID and non-COVID patients. The hospitals have been great partners with the Oklahoma State Department of Health. They've helped us through the situation. We've worked with them very closely throughout each change of our hospital surge plan, and they've been fantastic partners, but we do not manage them. They manage capacity. We do not manage capacity. Our hospitals are the experts in managing patient care and capacity, and they will continue to apply their expertise, as they always do, to continue to manage capacity levels and ensure patients get the treatment that they need. Oklahoma State Department of Health is here to provide assistance when resources are exhausted. Through meetings with the hospital CEOs and the Oklahoma Hospital Association, we've updated our hospital surge plan to meet our state's ever-evolving needs. This is built on the needs of Oklahomans, hospital management of their staff and capacity, and what they're seeing on the front lines as most needed. We have taken very specific actions working alongside with hospitals on their capacity. We know that staffing has been an issue both before COVID and during COVID, and we're going to be working with legislators on possible solutions to help fix that situation. We're also working with hospitals on support for treatment of COVID patients as care has evolved throughout the pandemic. We're working with other state agencies on transferring of recovering patients to ensure that flow in and out of the hospitals is not a capacity barrier. We're going to work close with the hospitals to increase capacity if needed and truly serve in that partner role as the hospitals continue to manage their systems. Today's discussion is about the hospital capacity and our healthcare system and updates to our surge plan. We're also working on long-term plans to improve hospital capacity throughout the state. We know that data on hospital capacity has been challenging, as the numbers are constantly shifting and dependent upon what is being reported to us and when. We're working to streamline our data dashboard to ensure that we are transparent with our data, but also giving as much context as possible to make it easy for Oklahomans to understand the current situation. I'm now going to turn it over to Matt Stacy, our OSDH Surge Plan Advisor, to talk through some of the details.
Thank you, Dr. Frye, Governor. Appreciate it. I wanted to say that since COVID became an issue here in early March, when the governor had the foresight to put together his Governor's Solution Task Force, of which I was a part of, this has always been a team effort. It's always been an effort that's with the Oklahoma Hospital Association, hospital CEOs, the military, which Dr. Frye and I are both a part of, and that's where we began this work, and then state agencies and private institutions. That we've always worked together. There's never been a conflict there. And so before we get into the new surge plan, I want to give a little history of the things we've accomplished since that point. So Surge Plan 1 had a sole focus on treating patients in hospitals. We didn't want the field hospital environment that some of the other states were doing. We wanted Oklahomans to be treated in a hospital environment, and we focused very heavily on creating that capacity and those resources so that we could do so. The state spent over $54 million essentially renting beds. We rented over 220 beds, and And we spent another $10 million in federal Army Corps of Engineers money in outfitting rooms to treat COVID patients in a negative pressure setting. We, importantly, we have retained an option on a 95 of those beds with one of our great partners at Integris Medical System, and that option remains through the end of the year. We spent millions of dollars building out our telemedicine network and platform through Oklahoma State University. We increased PPE supplies to over a 30-day supply and have maintained those levels. And then more importantly, we also contracted with long-term care facilities to take COVID-positive nursing home patients out of a hospital setting and into a better area for their care. A couple months into that plan, as this pandemic evolved, our surge plans had to evolve, and so we went and revisited this. We went into what we call Surge Plan 2, and that was a big focus on two things: testing and data. And out of that, we also spent $20 million, again, renting rooms to have those rooms available, working with hospitals who were great partners in that effort. And then we increased our testing capacity from just 100 per day when we started to now over 6,500 per day. And that's just within the public health lab network of testing. There's a lot of private options as well for testing. Finally, we're in Surge Plan 3, and that's where we're at today. And Patty Davis, our partner at Oklahoma Hospital Association, is going to go into some details on that, but I want to hit some of the highlights. One, the hospital has been a great partner with us in developing this data. They've created a real-time dashboard to track real admission data and COVID patients. We're working with specialty and rehab hospitals to develop their internal surge plans, as they're different than a traditional hospital, and that's a capacity of over 1,000 beds that are available among those hospitals. We're working with other state agencies to help expedite the transfer of recovering patients out of acute care setting like we have behind us into an area where they can continue to recover after they've gotten past the critical point in their treatment. We're working with agencies to develop locations for families that don't have the family support to support them at home, homeless population, and those with mental illness who sometimes can linger in a hospital system just simply because they have no other place to go. We're expanding our telemedicine support, and we're looking at reimbursement method for certain treatment methods. And finally, we're expanding staffing options through the Medical Reserve Corps and through licensing agencies. I'd like to turn it over to the Oklahoma Hospital Association President, Patty Davis, for some specific details on the new surge plan and the tiers created within it.
Thank you, and I'd like to echo Governor Stitt's compliments to the over 70,000 hospital employees who have worked for the last 7 months during this pandemic to keep their patients safe as well as their communities. We understand that there's a tremendous amount of professional dedication here, and not only that, a tremendous amount of personal sacrifice with their families while they manage their lifeblood work, which is taking care of Oklahomans. And also, thank you to the hospitals that pulled together this Surge 3 plan. We did this in a very short time frame, and we couldn't have done it without their expertise. Hospitals are still open for business, and if you have a medical condition, please do not hesitate to seek care. So as you've heard before, we've been pulled in to provide for a third revision as our numbers are increasing. This plan will only work with a strong working relationship with our state agencies, but our other healthcare providers outside of the hospital walls, whether that's nursing homes, long-term acute care hospitals, rehab facilities, and specialty hospitals, we all play an important part in making this work going forward. So to unveil what we're going to be changing in our surge plan, I want to explain that to you now. We will continue to rely on the green, yellow, red plan that we developed earlier in the spring. The plan continues to rely on regional trauma regions and designations that are already in place. And this time we are going to categorize hospitals differently in the Surge Plan 3 as such. First off, a primary hospital would be a hospital where they have the ability to maintain a COVID positive patient with less than 4 liters of oxygen and appropriate medicine. On the other hand, a secondary hospital is defined as one that would be able to have ICU capacity with specialized physicians to take care of the higher level COVID patients in need. And let me make this very apparent to you that both levels of hospitals are going to be required to be engaged in this process to make this work. The overall goal is still to keep the patient close to home within their region, if that is all possible, before we transfer outside of the region. The new revisions set threshold percentages for certain actions by hospitals, and these thresholds will be triggered after 3 consecutive days of maintaining that number. Now I'm going to get into a little bit of the numbers, and this is just a little bit complicated, but our hospitals that have put this together have great confidence that this can work. Tier 1, and this is where we are today in the state, is when hospitals are less than 15% of their admissions are COVID related. The admission percentage is based on a combination of both medical surgical beds and ICU beds. As a hospital reaches the 15% COVID threshold and capacity for all other patients, the hospital will initiate internal surge plans and to be able to expand their capacity to full ability to take care of patients. This will depend upon the state's ability to help us with difficult to discharge patients, as Lieutenant Colonel Stacy has already articulated, and I know that they're already starting work on that. And when we say difficult to discharge patients, these are patients that no longer need acute care level care, but they lack resources within the community to be able to provide care at a more appropriate level. Hospitals will need to work with our academic providers to create additional staffing, as Matt has already alluded to. Tier level 2 is when our COVID admissions in hospitals get between 15 and 19% of total med-surg and ICU beds. Hospitals at that level will continue to implement internal surge plans. We will also rely upon Medical Reserve Corps to help with our staffing, and then we will also be tapping our post-acute and specialty partners to help normalize our patient flow. Once again, this is based upon region. So when the capacity no longer exists within the region, the patient will be transferred to the next region that can provide appropriate care. Tier 3 is when our COVID admissions in hospitals are over 20% of existing med-surg and ICU beds. Selective surgeries will be eliminated. We will change staffing ratios to accommodate the higher patient demand, and our lower acuity patients will be transferred out of acute care to a more appropriate setting to create capacity for patients in need. Level 4, and let's hope we never get there, is when our admissions are greater than 40% and we have reached our capacity based on not only our internal surge plans, but also our region and state numbers. In that case, surgeries will be limited to only emergency cases, and at that time, unfortunately, we would be having to consider resource management tools to manage the demands on the hospitals. Let me make this very clear that this plan only works with optimal cooperation, not only from our state agencies, but our hospitals, along with nursing homes, long-term acute care, rehab hospitals, and specialty hospitals. And it will also take you as our citizens to make this work as well. Your part is to wear a mask, get a flu shot, practice social distancing, and washing your hands. Truly, these are the only tools that we have today to prevent spread, and we are counting on all of the citizens of Oklahoma to do their part so that we do not overwhelm our system. On behalf of the exceptional caregivers that are providing this care, we plead with you to please take this seriously. Thank you.
Well, good afternoon. On behalf of Mercy Hospital, I want to welcome you to our campus. I also want to recognize Tim Pearson with Integris Health and Chuck Spicer with OU Medicine. They've been great partners with Mercy and the other health systems around our state. I'd also like to say that it's an extreme blessing for us to be able to serve Oklahomans in this time of need, and I think we all feel that way. And so the level of cooperation. Patty, thank you, and Governor Stitt, thank you, Commissioner Frye, for being here and for supporting the hospitals in this effort. We're grateful for the support of the state and our fellow partners in healthcare, many of whom are here with us today. I would like to take this opportunity, however, to talk about two things. First, I would like to share some thoughts about our healthcare professionals in our state, and then talk about what's going on specifically with the care of hospitalized COVID patients. If any one of my colleagues were speaking today, they would comment on the amazing work of healthcare professionals around our state. Many think of the care in our hospitals, but I would add the care in our clinics, urgent cares, and other ambulatory locations around the state of Oklahoma. I can't say enough good things about the nurses, the physicians, respiratory therapists, all of our clinical staff, our environmental staff, our food services staff in each of the hospitals around the state of Oklahoma. They are simply incredible. Every day they earn the title of hero in my mind. They are dedicated to taking care of all of our patients, including those who have COVID-19, as well as their families. To each healthcare professional in our state, we say thank you. Thank you for your work. It is well documented that hospitals around the country are operating at capacity or near capacity. Many hospitals were operating at that level even prior to COVID. Your Oklahoma hospitals are no different than that. And like many hospitals around the country, we've been experiencing high patient census at Mercy Hospital, Oklahoma City, over the last several months. While we have recently seen an increase in the COVID-19 patients, we're also experiencing an increase in the number of patients who have other medical diagnoses. This is certainly a challenge, but it's a challenge that we're ready and willing to meet. We can do that only with the cooperation of all the hospitals working together, of which has been referenced many times. The hospitals around the state have collaborated as a team and created a new plan to more effectively and uniformly care for COVID patients in the state of Oklahoma. This new plan involves constant communication between facilities to clearly understand each other's capacity on a daily and sometimes even an hourly basis. The implementation of regional command centers that direct the transfers of patients will also be admitted, as Patty mentioned. When we are talking about hospital capacity or ICU bed capacity or availability at Mercy or any other hospital, it's a challenging number to report at any given moment because it's constantly changing. Patients are literally being discharged as we speak from the hospital behind us. Patients are frequently admitted or moved throughout our hospitals for the most appropriate level of care. Today, Mercy Hospital began the day with only 15% of our beds filled with COVID patients. So this is at that tier 1 level, and so we'll start implementing some of those protocols that Patty mentioned. As a part of the new plan, we've also identified specific triggers that will tell us when it's time to modify our plans. So we've learned a lot over the last 7 months. Each of the hospitals have learned a lot. We've learned from each other. And so we might change our staffing models. We potentially could transfer to lower acuity facilities, as Patty mentioned. We're not at that point yet, and this new plan will allow us to work together directly to decide when and if the time is right and necessary. We're also working with rehab hospitals, skilled nursing, and long-term care facilities, and they play a very, very important part in the care of these patients. Care for certain patients can be provided even at home with home care services or virtual care services, again, when it's appropriate and best for those patients. But most importantly, we want the public to know hospitals across the state are working closely together to do everything in our power to take care of anyone who needs us when they need us. As Patty said, as the governor said, we want people to take this and continue to take this virus very seriously. Continue following the recommended protocols, including now getting a flu shot, hand washing, social distancing, and mask wearing to help limit the spread of COVID-19 and the flu. We can all work together and we can protect our community one by one. Thank you.
Thank you, Jim. I want to thank everyone for their partnership on this. I think it's so important that we continue to work together to keep Oklahomans healthy. About 100,000 Oklahomans have now recovered from COVID-19. About 100,000. Like Dr. Frye said, there's about 14,000 that are within a 14-day period that are still fighting COVID. I want to remind those 100,000 that we really need you to give plasma. This morning I was at OBI, the Oklahoma Blood Institute, and met a lady named Tammy. And Tammy had received plasma. She got sick with COVID, received plasma from Representative Lowe, and it was just great, the connection. I'm proud to report that she recovered, but it's so important that we encourage Oklahomans that have recovered, and it's about 100,000, to continue to give plasma to help out our neighbors in need. You can find out more how to donate at obi.org, www.obi.org, or call 888-308-3924. With that, I'll open it up for questions for any of the folks up here. I think the question was mask mandates, and like I've stated before, every county is different. We're leaving that up to the municipalities. I think the question was staffing issues. I'll let somebody else take that.
Did you ask about the Medical Reserve Corps? So people can volunteer to provide medical services, train professionals through the Medical Reserve Corps, and they can call and we can get them set up with through that process to be able to provide services and help out in places of need. We're also working with the hospitals. They are talking about really innovative ways to look at staffing in order to move forward to ensure that they have enough staffing to fulfill the needs.
Has the state entered any agreement with the Medical Reserve Corps or any other licensing agency for reserve staffing?
We did early in the response during underneath the catastrophic health emergency that was proclaimed, but we're in discussions again with hospitals about lists of things that they might need us to help them with, or the governor to help them with through this process, and that is one of those things.
I have a couple of clarifications on the surge plan. So it's based on what percentage of admissions are COVID admissions at each individual hospital, is that right?
That's regionally, yes.
In a particular region, if 15 to 19% of admissions are COVID over 3 days, then that would activate that tier for that region.
That's correct.
Have all the hospitals signed up to be a part of that? Have they all agreed, yes, we agree, we will do all these things?
They've all been working with the Hospital Association and us. Yeah, go ahead, Patty. It's not every hospital, but Patty.
Thank you for that question. And it's important to note we've put this together very quickly because we're seeing the escalating numbers. So literally tomorrow we will be in communication with our hospitals so they understand these triggers and thresholds. They've been very good before with the different plans to be participants in that. So we fully expect our hospitals to embrace these changes.
Rotation of regions, you mentioned that at a certain point, patients, if their hospitals in one region are at capacity or at a certain level of capacity, rotated to another region. What does that process look like?
Not actually rotated, I think that's your word, but let's just be clear that one of our challenges has been to understand where capacity exists. So this 15% threshold, the attempt is if we can better share data that all hospitals within a region will be sharing at the same level. And so we'll be spreading that out so their otherwise operations can continue. So we want to make sure that all the hospitals in the region get up to that 15%, because what we don't want to see happen is one hospital has a lot of COVID, it's very disruptive to normal operations, where the hospital across town may have very little. So this is an opportunity for us to equalize within the region, to be less disruptive for patient flow if all possible. So literally, as a region fills up, we'll have to spill over into another region where capacity exists, and that's the basis of the plan.
Regional command centers to kind of manage that. Can you describe what their role will be and exactly what they do?
So essentially, these regional command, each of the hospitals stood up command centers when we started facing the COVID challenge. And so essentially, we'll have one regional command center for each region. That regional command center's job is to look at the capacity of each of the hospitals and to make sure we do balance, as what Patty said. We're still analyzing that information, so we should have that, as Patty said, in the next day or two.
Right now?
No.
Will that be shared on a daily basis?
I don't have all that information with me today, but statewide we've been under 15%. So, but yeah, we'll be updating that, and we look at that every day as well. But we'll be sharing that, working with them very closely. And again, it's not a one day. They're doing 3 days. If they have to stay in that level for 3 days.
Are you using any CARES Act funding for this? Are you using any CARES Act funding for this new surge plan?
Are we using CARES Act funding for the surge plan? CARES Act has been, funding has been very helpful throughout this whole process. We are not using the prior contracts, have not been re-engaged at this time.
Are we considering any other measures to help reduce transmission of this infection in our population?
Yes, we are still echoing to everyone that they need to do the 3 W's that you heard the governor talk about, and we are always looking at all cards are on the table every time we have conversations about it.
Commissioner, I have a question about unemployment, if I may. So today, OESC announced that the work search requirements will be reinstated, or actually they will, the executive order waiving work search requirements for unemployment will be waived at the end of this month. Could you kind of talk about that? Are you considering an extension for unemployment payments? They don't have to.
Well, we're working with our federal delegation on all the stimulus package and what other federal dollars are going to be coming into our state. But if you saw that, unemployment data got released for September, and Oklahoma was top 9 in the country, 5.3%. So it shows that Oklahomans are back to work, and we have less people applying for unemployment right now. So we're obviously trying to get those folks back into the workforce and take advantage of every federal dollar we can. But right now, the normal process is in place to help Oklahomans, those 5.3% that are unemployed.
Governor, what's the timeline for the hospital surge plan if the hospitals haven't formally signed on yet, and you guys can't tell us what each region is at right now? I mean, how long does this take to get implemented?
Well, I think the important thing to remember, they're working together very hard to get this surge plan out. Less than 15% of hospitals in Oklahoma, this is something Oklahomans need to understand, less than 15% are COVID patients, and they've got a plan in place that if it goes between 15 to 19, they'll enact phase 2 and so on. So we have the capacity in Oklahoma. Anytime that we need to, we could issue some of the executive orders that we did in March that limited elective surgeries to create tremendous capacity. But we're going to let the hospitals, we don't want to mandate those kind of things to the hospitals. So that's why the hospitals are doing a fantastic job of putting these plans together to work across the entire state to make sure that every part of the state has capacity. There's not one hospital that's overloaded, as Patty said. But the important thing for Oklahoma to understand is we have capacity to treat COVID and non-COVID patients. We're under 15% of COVID patients in the hospital, and we have plans in place if that number continues to rise.
Estimates of for each tier, how many patients would have to be in the hospital for us to exceed 15% and go into tier 2, and then exceed that and go into tier 3, and then, worst case scenario be tier 4?
Yeah, sure. So about 5,000. I'll let Patty. You want to address the exact numbers?
So to quantify these percentages, because I think that is an important question to ask, If we're talking less than 15%, our threshold at less than 15% is 851 patients in the hospital with COVID. The 15 to 19% trigger will mean up to 1,078 patients would be COVID or PUI, which are persons under investigation for COVID. Level 3 would mean up to 1,135 COVID positive patients or PUI. So I think that gives you a range for understanding where we are today. And as Dr. Frye mentioned, the health department does keep track of capacity by region, and I'm sure that he can be providing that to you.
Aren't the tiers, like isn't it if one of the regions hits a certain tier, like how many COVID patients do we have to have in the hospital in the Oklahoma City region to hit the first or the second tier?
Well, that would depend. They would all have to be at 15% COVID to hit the second tier. All the hospitals within the region, and as they spill into the other region for transferring patients, that other region would come up as a result as well. So we have to have the ability that once we are at capacity, that we can send that patient to the most appropriate facility that can provide the care outside of the region.
We have to get the governor to another event. We'll keep Dr. Frye here and then put these other questions. Anybody have anything else? Anybody else?
Dr. Frye, can I ask you one more thing?
First, I'll address your question about the copy of the surge plan. We will be publishing that when it's final on the Oklahoma State Department of Health website, where we publish the other surge plans. So.
Guys, I guess you don't have a number, but what percentage each region is at right now? Will you be releasing?
So we do calculate that. I just don't have that information with me. We usually do a 7-day rolling average, and we're in the process of, we've met with the hospital association and the hospital CEOs every day for the last week and a half, and it takes a while to really analyze everything. They did another survey throughout the state to find out, try to modify like what are our real capacity numbers that we can get to now based off of where what's going on in the state at this time. It just takes a while to get all that together and to work through it, but we'll have that out in the correct format as soon as possible.
That'll be made public what each region is at any given time. Okay.
Yes.